So in terms of thinking of checkpoint inhibition for myeloproliferative neoplasms, there has been excitement in terms of the checkpoint blockade for a variety of malignancies, including hematologic malignancies. And so we recently completed a study utilizing Pembrolizumab in patients with advanced myeloproliferative neoplasms, specifically myelofibrosis. And unfortunately, we did not see any responses in the patients that were enrolled in the study. So this study was a Simon two-stage design, which was the first stage had 9 patients, and if we saw more than one patient respond in the first stage, we would move on to the next stage. But unfortunately, of the 9 patients that were enrolled, none of them achieved a response. All of them really did have stable disease, which perhaps is meaningful. But what we did see, though, is that the T cells in those patients did show signs of activation and expansion with checkpoint blockade, suggesting that there's potentially some use for checkpoint blockade in MPN patients, but maybe our approach needs to be different. Perhaps we need to utilize checkpoint blockade earlier in treatment. So patients that have been treated with checkpoint blockade in myelofibrosis thus far, our study as well as a nivolumab study from MD Anderson, were patients that were later on in their disease treatment. And we need to remember that MPN patients maybe have lived with their MPN for many, many years. And so those T cells are chronically exposed to antigen. Those T cells are senescent and exhausted and do not have normal immune responses. And so perhaps reversing that immune suppression requires more than one checkpoint blockade, or requires using these treatments earlier on in the disease course, where perhaps there is a higher likelihood of having a response to the T cells when there's not that much T cell exhaustion.